You live now to the Blue Room where the Prime Minister Scott Morrison is speaking on coronavirus.
Said that we would be working closely together with states and territories to ensure that we had a fair set of arrangements, to ensure we worked together to meet the costs, particularly the public health costs, in responding to the coronavirus. Last night, Treasurers linked up by a phone hookup, and today that was followed through by health ministers. As a result, following those meetings, I have indicated to Premiers and Chief Ministers just prior to this meeting through a contact that we would be forwarding an offer for a standalone national partnership agreement on a joint COVID-19 public health response where there would be 50-50 cost sharing between the Commonwealth and the states for those additional costs for public health in relation to responding to the COVID-19 outbreak. The Commonwealth, upon executing those agreements, will immediately put $100 million down as an advance through the normal distribution mechanism to the states to ensure that they're in a position to immediately meet those costs. This arrangement, I should stress, that it relates to expenditure incurred from the 21st of January 2020. So we're obviously reaching back into costs that already would have been amounted up until this time, but of course we're anticipating that going forward that those costs would be greater. Now this is a standalone arrangement. It's not linked to any other hospital funding agreements. There are other matters we're pursuing with the states there, and there is no suggestion, and I don't want there to be any connection between those issues. This is about dealing with the coronavirus and making sure that the states can have confidence that they're leaning forward and responding, that we're leaning forward and responding with them. We are anticipating, although it's a demand-driven arrangement, the costs will be what the costs are. But we are estimating, based on the advice we have at the moment, this could be as much as about $1 billion, $500 million each, that we would at least have to be allowing for. I hope it's not that much. It could be more. But we at least, I think, have to enter into these arrangements having some sense of the scale of what we're dealing with here. I know that's a significant amount, but as we have said to you in numerous briefings over recent weeks, we have to be prepared. We've got to stay ahead, and a funding arrangement like this, I think, enables and equips the states to be able to move forward confidently to deal with the challenges that exist, whether it be in the public hospital system or the normal type of public health response that they'd provide in the event of an influenza outbreak. And so just so you get an understanding of how this might be different to normal arrangements, the current hospital arrangements is a 55-45 split. The Commonwealth normally pays 45. We're upping that to 50% as part of that arrangement. And it normally, if you've got a public health response in a aged care facility or in a child care facility or something like that, normally the states pay 100% of that public health response in those areas, and we'd be very happy to shoulder those costs 50-50 with the states because of the serious nature and very specific nature of this virus. Now, it'll be administered in the normal way by the Independent Hospital Pricing Authority and by the Administrator of the National Health Funding Body. I'll be formally writing to Premiers and Chief Ministers today, and I hope after discussing it over the course of the week we'll be able to tie this up by the end of next week when COAG meets in Sydney next Friday. So I really do want to thank the State Treasurers and Health Ministers for the work they've done. I also want to thank, of course, the Treasurer, Josh Frydenberg, and the Health Minister, Greg Hunt, for the work they've done both last night and today, and all the cooperative input and participation of all of the health ministers around and treasurers around the country. Everybody's working together on this. We all understand the challenge that this presents, and I think it shows a great sense of assurance to Australians that governments at state and federal level are working together, dealing with the things we need to get to, so you can go about your business in the unusual way and be confident about the preparations that are being made and that the resources that are being made available to support this. And we're obviously in a position to do this, having brought the budget back to balance. This is why we do these things, so we can actually respond in this way and to give the states the assurance they need as they go about the important work in delivering the public health system.